Senators. I want to start by thanking the committee staff, as always, for their hard work on this bill and make clear that I'm accepting committee amendments. Today, I'm proud to present AB 2085. This bill streamlines the development for necessary reproductive health care clinics across California. The development of these clinics would be in areas already zoned for office, retail, healthcare, or parking usages. As a state, California has enacted legal protections for abortion. However, we know that across the state, access requires both legal protection and physical access to the healthcare itself. Unfortunately, we've seen cities and counties block the construction of these clinics through bad faith requirements and unnecessary regulatory hurdles. Cities are preventing basic healthcare provision in areas that are already struggling to receive adequate healthcare access. And let me be clear, in some parts of our state, there is not enough access to reproductive health care, whether we're talking about prenatal care or STD or the like. And so for communities to come in and block clinics that will provide this critical health care is really a detriment to their own communities. AB 2085 requires ministerial approval of clinics that meet all of the locality's standards, ending the arbitrary obstruction of this life-saving care. With me today is Molly Robeson with Planned Parenthood California Action, and Elena Chavez from Training in Early Abortion for Comprehensive Health Care.
Welcome. Good morning, and you have 2 minutes.
Okay, great. Thank you. Good morning, Chair Darasso and members of the committee. My name is Elena Chavez, and I am the Program Manager for TEACH, which stands for Training in Early Abortion for Comprehensive Health Care. And we are proud co-sponsors of AB 2085. Thank you for the opportunity to provide testimony for this critical bill. When I was 17 years old, I had my first pregnancy scare. A senior in high school, I knew immediately that if I was truly pregnant, that I did not want to be. Feeling scared and alone, I looked up abortion near me on my family's desktop computer. I felt sick when the results came up. 49.4 miles away, a 54-minute drive, and an hour and a half minute bus ride. How could I possibly get there with no money, no car, and two amazing but overly involved parents? As the weeks went by, I grew more and more scared and isolated myself from my family and friends. Luckily, I eventually started menstruating, and it felt like the biggest weight was finally lifted off my shoulders. However, I was just one of the lucky ones. You see, my hometown has one of the highest STI and the highest teen pregnancy rates in all of California. By the time I graduated high school, 15 of my peers were already parents, with many more walking across the stage to accept their diplomas. Why? Because my hometown has little to no other options for care than crisis pregnancy centers, or fake clinics, that promote abstinence-only sex education and lie to people, typically who are poor and or BIPOC, about the full availability of the pregnancy options. I'm sure you're wondering by now where I'm from, and I'm proud to be from Visalia, California, the gateway to the Sequoias. So that's why I'm here today, to show you how harmful a lack of reproductive health care was years ago for people in rural and medically underserved parts of the state. Unfortunately, however, not much has changed. To this day, Visalia still does not have an abortion provider or clinic to provide this care. In fact, when I looked up Visalia abortion just yesterday, the first thing that pops up is a fake clinic where they lie about medication abortion being reversible. In fact, when a new clinic was trying to open up in Visalia, local opposition prevented clinic construction from beginning, leaving many vulnerable populations without access to care. And Visalia is not the only location this has happened in. This has been happening throughout the state in more rural areas like Fontana, California, that are already healthcare access deserts.
Could you please wrap it up?
Okay, sorry. So that's why AB 2085 is needed now more than ever. AB 2085 expands healthcare access in California for our most vulnerable communities by creating a more streamlined process for clinic construction to address the difficulties many health centers have faced when opening new clinics.
Thank you.
That's why I'm here asking for your aye vote. Thank you.
Thank you for coming.
Good morning, Chair Durazo and members. I'm Molly Robeson. I'm Vice President of Government Affairs at Planned Parenthood Affiliates of California, where we represent the 7 affiliates in the state who operate over 100 health centers and provide sexual and reproductive health care to almost 1 million patients annually. Planned Parenthood is sponsoring AB 2085 to streamline the permitting process, as you just heard. Since the Dobbs decision 2 years ago, we've seen attacks on abortion, reproductive health care, gender-affirming care, and birth control all intensify, transforming health care into political battlegrounds, which has dangerous consequences. Even in California, we've seen these attacks in action. For example, as previously mentioned, in the city of Fontana, the local Planned Parenthood received verbal approval to construct a new clinic on a vacant site already zoned for healthcare. After following standard procedure, abiding by all local guidelines, and adjusting as needed to ensure compliance with local planning standards, it was a surprise when, after a year of planning, the City Council placed a temporary moratorium on any new buildings in the area. The Council then placed another moratorium, this time for 10 months, which has now been determined to only impact the health center. In a post-Dobbs era, when millions of people have lost access to abortion and other reproductive health care in their home states, it is critical that in California, access is not impeded. The Fontana Health Center, for example, would have provided an estimated 2,000 medical visits per month and positively impacted the community, yet remains on hold. AB 2085 ensures that local jurisdictions cannot unjustly interfere with the delivery of health care and delivers on California's commitment as a reproductive freedom state. I respectfully urge your aye vote today. Thank you.
Thank you very much. Anyone else in support of this AB 2085?
Martin Radosevich, on behalf of Reproductive Freedom for All California, proud co-sponsor of the bill. Thank you.
Thank you.
Good morning, Chair and members. Brady Garden on behalf of the League of California Cities in a supportive amended position looking for the ability to separate from sensitive areas as well as an extension of reviewing a completed application deadline from 60 to 90 days. Thank you.
Thank you.
Thank you, Madam Chair and members. Megan Subers on behalf of CPCA Advocates in support.
Thank you.
Genesis Gonzalez on behalf of Lieutenant Governor Lenny Kounalakis in support. Thank you.
Thank you.
Kathy Mossberg on behalf of APLA Health and Essential Access, both in support.
Thank you.
Brianna Nelson on behalf of Teach in strong support as co-sponsors of the bill.
Thank you. Anyone else in support? Seeing none, anyone in opposition? Good morning.
Good morning. Chair and members, my name is Greg Burt with the California Family Council here in opposition to AB 2085. We believe this bill undermines...
That you have 2 minutes.
Yeah, 2 minutes.
Thank you.
We believe this bill undermines local control, infringes upon religious liberty, and unjustly gives special privileges to abortion facilities, which California does not have a shortage of, while neglecting the needs for more prenatal and maternity care. This bill would force municipalities to open abortion facilities as a right and permits lawsuits against those that don't comply. This overreach circumvents the local city councils that have the right to decide which businesses are permitted within their jurisdictions. Just as cities regulate the location of tobacco and liquor stores or casinos, they should have the right to decide where abortion facilities go. Abortion is not just another healthcare service, it's a profound moral issue deserving the highest scrutiny and local discretion. By forcing municipalities to accept abortion facilities, the state imposes a particular moral view and discriminates against reproductive care that is critically needed. 1 in 4 women in California received inadequate prenatal care. 46 maternity wards have closed down since 2012, and the maternal mortality rates are increasing. It is inconceivable to prioritize the expansion of abortion facilities while neglecting essential maternity and prenatal services. It's unethical to mandate abortion clinics in communities that lack adequate facility to support pregnant women. Women in rural areas face severe challenges in accessing quality maternity care, and this bill does nothing to address those disparities. It's like you don't want women to have babies in certain areas. We should be rejoicing at pregnancies, not treating unborn babies like a deadly disease that need abortion as a cure. Abortion is a violent answer that harms both the child and the mother, and Californians deserve better. Thank you very much.
Anyone else in opposition? Seeing none. Okay. Yes, come forward.
Pastor Brandon Campbell, Northern California Director of Baptist Biblical Values, in opposition.
Thank you. Okay, we'll come back here. Any comments or questions? Okay, seeing none, you have the opportunity to close.
Thank you so much, Madam Chair. And I just want to say that as someone who has had 3 pregnancies, all of which I considered incredibly joyful, and I celebrated each and every one, who was lucky to live in the Bay Area where I had access to incredible prenatal care and needed it every single time, as every woman does. I think that the opposition made my point for me about the lack of access to prenatal care across California. These community clinics do a lot more than provide access to abortion, and the blockage of them is harming our future and our communities. So with that, I respectfully ask for an aye vote.
Thank you. Thank you very much. Okay, the bill has been moved by, but we can't accept it until we take the quorum?
Yes.
Okay, hold on. All right, you're lucky. We're going to take quorum.
Senators Durazo.
Here.
Durazo present. Sayarto. Here. Sayarto present. Dolly. Glazer. Here. Glazer present. Skinner. Wahab. Weiner. Present. Weiner present. You have a quorum.
Okay, now we'll take.
7 members? We have 7 members?
Yeah.
We have 7.
I move the bill.
Okay, bill
Has been moved.
AB 2085 has been moved by Senator Weiner. We'll now take the vote.
Motion is to pass as amended to the Committee on Environmental Quality. Senators Durazo.
Aye.
Durazo, aye. Sayarto. Sayarto, no. Dolly. Glazer. Glazer, aye. Skinner. Wahab. Weiner. Weiner, aye. 3-1.
Thank you, Madam Chair.
Leave that open.